So you have cone beam in your office, 3D technology, but you're not an oral surgeon.
That's right. You know, it's funny, in my neck of the woods, there aren't a lot of oral surgeons that have it yet. I implemented it because I wanted the information. I'm an info junkie. And really what I wanted was the ability to have all that information to help me treatment plan the cases that I have. But then if I want to send a case out, I want that information ahead of time for a couple of reasons. Number one, the most important thing you want to do is make sure that the patient is well taken care of. But the second thing is, as a general dentist, I kind of feel a certain, affection for my colleagues, and I want to make sure that they're getting the best outcomes with their situations as well. And so, if I can provide that information to periodontist, oral surgeon, prosthodontist, whoever is going to also be handling the case, I feel it's just a better outcome for the patient and for the referring doctor.
But cone beam technology seems to be something like gosh, I mean, unless you're placing the implants or you're doing the orthodontics, I mean, as a general dentist, do you find it important for you?
Yeah, I do. The implant part of it, as you said, is pretty big. Orthodontics, we do some ortho in my office as well, but we also do, TMJ treatment. We're also big into endodontics, and so I do a lot of my own endo retreats. People will come in with a failing root canal and want me to retreat it, and so before I get into it, if it's a case that I don't know anything about, I need to get all the information I can before I start, so we also use it in those kind of situations. And we also provide scans for other doctors. So sometimes a patient will just come in on a referral basis and say, Dr. Smith said I need to come over here and just get a 3D image because they want to do, something with it, whether it's implants or endo or oral surgery, ortho, whatever.
How have the patients responded? I mean, they're pretty impressed by the technology?
The patients are just blown away. In fact, we've started to build in, when people come in, we try and build in like 5 or 10 minutes more to the appointments now because we know when we scan them, that the patients are going to look at the screen and go, whoa, what is that? And so we actually have to sit down with them, and even though, they're not doctors, they probably don't understand it a lot, they get the idea of what they're looking at. And so, when we first got the device, we were just, take a scan and thank you, and we started to notice that so many people are like, no, I want to see, what is this, because they watch it come up on the screen, and so now we're just actually adding time on that we can just educate them about it a little bit, and the patients are just blown away by what they see.
How about your staff? I mean, there's a certain change that this technology brings to your practice. I mean, would you or the staff ever go back again?
Oh, no way. No way at all. I mean, once, it's the old thing of you don't know what you don't know. And then suddenly when you see what you didn't know before, well, there's no way you can go back because treatment in so many instances is a guessing game unless you have all that information at your disposal, So would you throw your TV out? Some people do, but I think, you can get so much information off of, the visual aspect of TV as opposed to radio. This is kind of the same sort of situation. I just can't see not using this on a regular basis anymore.
So how do you use it for your treatment plan? Let's say someone comes in, is it part of your initial screening, or are you taking it in just specialty cases?
I'm taking it in specialty cases. We have a Gendex 9200 digital pan anyway that we had before we brought in the CB500. So in that regard, we're taking pans on everybody, but then, when we get into a certain situation of, if it's oral surgery and we're going to send them out for third molars, I'll scan that. If we're going to do some implants or a complicated, restorative case of some type, then we're going to take, a scan on that. So it's on a case-by-case basis. We're not scanning everybody, although I can see at some point in the future that may be the way this whole thing goes.
Now, there's a lot of cases where people kind of say, gosh, I never would have thought that had I not seen it in 3D.
Right.
Do you have any cases where you've done it, a scan, and it kind of really changed the way you were going to treatment plan something?
Oh, yeah, absolutely. The one that jumps out in my mind is an endo case. Once again, it was a retreat. Somebody came in, they were in pain. I looked at it, and it just, it looked pretty much like a straightforward case. But I've learned over the years that, endo retreats, if you ever do any of those, there's never such thing as a straightforward one. And so what we did was we scanned it, and lo and behold, there was no, excessive probing depths or anything, but there's all this bone loss about, maybe halfway to 2/3 of the way down the root. And the root's fractured, and you couldn't see that anyway. And so I'd have gone in there and retreated it and then waited for it to heal and all these kind of things, and I put the patient through all of this and the time, the expenditure. And this situation needed an extraction and implant. There was no way I could have figured that out without that. Saved the patient probably 6 months of their life.
So 3 words that describe cone beam technology in your office.
Mind-changing, informative, and amazing. You just cannot believe what you'll see. It's really